What's up, guys? I'm Dr. Josh Jagoda, and if you're having low back pain or if you want to help yourself with mobility within the hips and the spine, then definitely check out and watch the rest of this episode. So a lot of times we have our essential movements, and one of those essential movements that is critical for our performance is the hip hinge. But sometimes if you have low back pain, if you're having sciatica, if you're having a hot disc or something like that, it might be too uncomfortable to do these positions. And if you know what I'm talking about with the hip hinge, then you know what I'm saying. But if you don't know what I'm talking about with the hip hinge, go back and watch some of those videos. But sometimes a hip hinge or even gross movement is really, really hard to do. So today we're going to show you a warm-up drill that you can do for your spine that will help improve your pain and increase your mobility. All right, guys? So the first thing we're going to do is we're going to get onto all fours. When we get onto all fours, our number one goal is to keep our back nice and flat. We don't want it rounding this way or rounding that way. We don't want to be staggered or uneven. We really want to be very symmetrical, okay? After we got that in place, we want to fire our core, okay? Make sure our belly is nice and tight. And then we're going to walk our hands out about 2 inches or so. Also, from this position, what we're going to do is keep our toes engaged with the ground, because if we have pain, we want to be able to spring out of it very quickly. If we're like this, we might have some difficulty doing that. So I like to keep my feet just like this so I can spring out of pain if I need to. So what we're going to be doing is essentially a quadruped unweighted hip hinge, right? So we're doing hip hinge, but we don't want to go too far, okay? We also want to keep this in mind. So how are you going to know if you're going too far? Well, one, your body's going to tell you through pain. And two, if you don't know, then maybe record yourself and then film it and then see where you're at. But I would usually use feedback within pain, okay? That's a really good one. So from here, we're going to come in. We're going to walk our hands forward a little bit, keep our spine flat, and then we're going to go all the way back. Not all the way, but just a little bit back, and then come back forward. And we're going to just hinge back and forth. This is going to really warm up our spine by keeping our core tight and our hips as well. And of course our arms and our hands, because we're on our weight, on our feet, on our hands here. Now, a lot of people will make this mistake. Watch this. Watch my butt area, okay? What's going to happen is they're going to go all the way back to a point where this happens. Their butt will round. Or what happens is they'll come up here and they'll round their spine here, right? And this is a bigger problem actually here, okay? So when you are taking your spine and you're rounding it, and it rounds and it falls off, like kind of like that butt wing type of situation, that's when you're going to lumbar flexion. So if you're having pain bending forward with your lower back and then you start doing this and you have pain, then you probably know that you are going way too far past your range of motion. You're going way too far in terms of lumbar flexion, and you're starting to introduce the stimulus of pain into that. And that gives me an indication that you're doing this too much, so that you're getting flexion into the spine. The goal is not to go into flexion for this, guys. It's to keep a nice, even spine that's really rigid, but has the hips moving around that tight spine and tight core. So think about that, okay? You want to walk forward a little bit, keep your toes engaged, and that's why I said if you start doing this or this, you could spring right out of it. Come back and forward. Back and forward. Trying to really visualize a straight spine, and you don't want to do this either, okay? Back and forward. And I would recommend that, depending on the individual and how warm you are, we're not moving that much. We're only moving about this much, guys. And so you want to make sure that you're doing a few repetitions, at least 5 to 8 repetitions, maybe up to 10, taking a little bit of break and then doing that 3 to 5 times, okay? This is going to be really beneficial, especially if you're having severe low back pain, just getting your body moving again, all right? So try this out, guys. My name is Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys next time, and don't forget to subscribe to our channel. See ya.